shortly. I did want to start with a territorial acknowledgement. So ARPA would like to acknowledge the First Nations, the Métis, and all of the people across Alberta who share a history and a deep connection with this land. We dedicate ourselves to moving forward in partnership with Indigenous communities in the spirit of reconciliation and collaboration. Today, I am located in the ARPA offices in Edmonton, and we're located in Treaty 6 territory, a traditional gathering place for diverse Indigenous peoples, including the Cree, Blackfoot, Métis, Nakota Sioux, Dene, Iroquois, Ojibwe, Saulteaux, and Anishinaabe, Inuit, and many others whose histories, language, and cultures continue to influence our vibrant community. We'd like to pass on our deepest condolences to the Tickamlips Desquapum First Nation and to the families of the 215 children found in the mass grave at the site of a former residential school in Kamloops. I'm wearing orange today to honor not only the survivors of the residential school system, but to those whose lives have been lost as a result of and to the families that continue to realize the deep intergenerational trauma from these events. ARPA walks its own reconciliation journey, and we strive to honor the memory of those who walked alone or walked before us. It will take a combined effort from all levels of government, corporate entities, and nonprofit organizations and individual leaders to finally end racism, violence, and discrimination against Indigenous peoples in Alberta and across Canada. We in sport and recreation have an important role to play, so I would ask that each of you reflect what you and your organizations can do to support the needed change. Thank you for that. So to start off with, I'm going to pass it over to Damien, I believe, and Damien's just going to do a little intro in terms of the open to summer plans, and then we'll get into some questions.
Thank you very much, Steve. Pleasure to be here, and thank you to ARPA for convening this session today. It's always great to get a chance to talk to our municipal recreation providers, our provincial sport organizations, our local sport organizations, fitness centers, and many more who are operating in this sport, physical activity, recreation space. As Steve said, I'll provide a quick update in terms of the Open for Summer plan. Just make sure that we have some common grounding to start the questions here today. I'm sure many of you have seen the plan, and I know while there's about over 400 of you in attendance, I know a few of you have probably already heard this update from me and a few other engagements we've run of similar style. Of course, last week, the government of Alberta announced the Open for Summer plan. It's a 3-stage plan tied to vaccinations and declining hospitalizations rates in the first 2 stages. Stage 1, which we are now in, which I won't spend too much time on, it was triggered by having 50% of Albertans 12 plus having at least 1 dose of vaccine and hospitalizations being below 800 and declining. One key feature of that I just want to really highlight is it is the ages 12 plus that we are basing our metrics off of. Some other provinces have gone with adult populations, 18 plus, et cetera. But one of the key features in our Open for Summer plan is that all eligible Albertans who can get vaccinated are included when we are looking at our percentages. Stage 2 is triggered by 60% of Albertans ages 12 plus receiving 1 dose and hospitalizations being 500 or below 500 and declining. I'm sure that's where a lot of the questions are coming from today. And just a quick overview, there's a number of implications for stage 2 for the groups here, and I know there's lots of interaction, so I just want to make sure I spend a little bit of time here. With stage 2, outdoor social gatherings can increase up to 20 people with distancing. Wedding ceremonies can occur with up to 20 people in attendance. Receptions are permitted, but outdoors only. Funeral services can remain unchanged with 20 people permitted, but not including, that doesn't include facility staff, funeral clergy, et cetera. Restaurants in your communities can be open with tables of up to 6 people indoors, outdoors, not bound by household requirements. And certainly that's going to be important for many of you who are operating multi-use recreation centers with food and dining capacity. Retail capacity opens to 1/3 of fire code. Gyms and other indoor fitness can open for solo drop-in activities with 3 meters distancing between participants. Fitness classes may also resume. I know we'll get questions on this. That's not going to be tied to an intensity restriction, just so we can kind of put a check mark beside that one. Indoor, outdoor, youth, adult sports resume with no restrictions. This is really pertaining to the activity, and we'll get into this, I'm sure, as we go throughout the day. The activities themselves, playing basketball, hockey, figure skating, etc., won't have specific question or restrictions, but what we will see is some of the surrounding areas having some restrictions tied to them. So as we talked about rec centers, 1/3 capacity, we'll talk about change rooms and things of that nature as we go forward. Youth activities are permitted in stage 2, such as day camps, overnight camps, play centers. There will be some restrictions associated in stage 2 with those pieces that we can get into in a little bit. Personal wellness services, particularly for those of you running rec centers, can resume for walk-in services, not just appointment, but walk-in services will be allowed in those spaces. The work from home order is lifted, but still recommended. So your employees can do not have to work from home, but it is recommended if functionally possible that they still remain doing so. For people with outdoor venues, outdoor fixed seating facilities can open with 1/3 seated capacity. So grandstands, football fields, etc., things of that nature. You can fill up 1/3 of your seats. Public outdoor gatherings can increase up to 150 people for things like concerts, festivals, events in parks, things of that nature. If you were to have an event and you didn't have fixed seating capacity, that would be the capacity number to look at, again, 150 people. Distancing and masking requirements do remain in effect in a number of spaces, and we can get into more of that detail here in a sec. As you move to stage 3, 70% of Albertans 12+ with 1 dose. That's 2 weeks after that is when we would begin stage 3. All restrictions are lifted, including the ban on indoor social gatherings. Of course, we'll still have a few pieces as it pertains to isolation. If people are sick, contract COVID, there'll be a few pieces in there too, just to protect vulnerable populations like people in continuing care settings. Just a quick highlight I'll touch on in terms of timing. Right now with stage 2, it's trending for June 10th. So the government has announced that it provided that hospitalizations continue to decline, June 10th would be the starting date for stage 2. So that's something that we're keeping an eye on day to day. They have been falling day over day here for the last several days. When we're looking at stage 3, just a quick update. I know online, I think it says 64% of eligible Albertans are vaccinated. Just took a little peek in terms of the most latest data that we have access to, and it's trending towards 66. So that continues to flow, and we're certainly seeing strong numbers of people still going out and getting that first dose. I know that's something that we've heard a lot in terms of feedback since we've made the announcement is 70% feasible, and certainly it is. I think Premier tried to comment in the announcement of the plan that when we're looking at that data, we're basing it on appointments that are already booked. We're also basing that on assuming there'll be cancellations and double bookings, and we're also trying to pull that data back and look at it from a more conservative place. So we do have a high level of confidence on that 70% of Albertans receiving that first dose, in case that question was popping up or going to pop up in the session. Steve, with that, those are kind of some opening comments just to kind of, again, ground the Open for Summer plan. And happy to go through questions that were submitted and ones that are popping up in the Q&A.
Sure, thanks. Yeah, so keep looking at your upvoting questions. It looks like we're getting some great ones coming to the top there right now. So just to build off the June 10th clarification. So you mentioned that June 10th could be the earliest date that we would go to stage 2. What does notice look like? Are they going to tell us June 10th? Are we going to get a notice period? I know a lot of us have to bring back staff, and many probably are already thinking about that. But just in terms of planning and organizing, what does a notice period going to look like for that?
Yeah, right now, I think part of the intention of getting a bit of a soft notice out there was to support people as they're planning. Of course, I know, especially for many of our municipal partners on this call, that in order to recall their staff, they need 7 days notice, et cetera. My anticipation is that we're going to continue to just monitor the hospitalization data throughout the remainder of the week. And I would expect more of a formal announcement next week as we get just have a little bit more time just to make sure that there is a proper trend saying hospitalizations are declining.
And will there be a health order that will be aligned to stage 2 and any other guidance documents coming out?
Yep. So there still will be some level of public health restrictions in stage 2. So there will be an order associated with it. We will produce guidance documents as well. We're working behind the scenes to get those updated and approved. Our anticipation is for a lot of the guidance documents, in particular sectors that we haven't had guidance on for a long time. We will get those out as soon as we possibly can, and we're trending to get those out before the 10th for a number of the groups on this call.
Okay, and so with the sport in particular, sport and recreation, they're kind of as we enter the stage 2, there's kind of this no restrictions is kind of the terms I think most people are focusing on there. So what does that look like for, I'll call it, like, I know there's different terms here, but on field of play or activity space, is it truly no restrictions when it's in the field of play or activity based? And then what about the spaces around it? So I see, like, and you may have to write some of these down, I'll try and remember them too, but there's spectators zones, there's change rooms, there's in indoor facilities, there's walkways and pathways and pinch points and stuff like that. So there's obviously that stuff that happens outside and inside that's not on the field of play. So what's the difference between the two? What do they look like? And is it truly no restrictions?
Susan, I saw you take your mute button off right away, so I don't want to get in front of you on this one.
No, that's fine. Yeah, and that's a great question with the no restrictions. So the way that I'm looking at it is that there's no restrictions to resuming that type of activity. So I think where we've been, I think we also have to look at like where we are now, where we have been, which is basically a shutdown, not even training, not even able to train, and now we're able to train only in the outdoor setting. And where we're moving to is to actually enable the types of activities that you can't do distance and mass to actually be doing those activities. So no restrictions means that if your sport is basketball, you can play basketball, that you don't have to just train for basketball and just shoot hoops all 2 or 3 meters apart, that you actually can actually play basketball if that's your chosen sport. So there will be, because stage 2 will still have an order, so there will still be both guidance, as Damien mentioned, there will be stage 2 guidance and there will be a stage 2 order. So if we're talking in an indoor environment, the public health orders for masking will stand. So there will be places that you should mask, and then there'll be exceptions to where you're able to take your mask off. So while you're doing your sport, training for your sport, playing a game, those kinds of things, you will be able to take your mask off, and then you will need to put your mask on as you enter those other spaces and you stop doing that sport. And that's generally how our masking rules have been to date, is that there is exceptions, and there's a when you must have it on, and then when you're permitted to have it off. So I think that's the way I look at it, is that there will still be rules and guidance and like a public health space to have those outlined for people, but that it's a much more enabling step. Like it actually allows the activities that everybody wants to get back doing to actually get back to actually doing those activities how they were meant to be done.
Yeah, and the way I kind of think of it, Steve, is there's the activity itself. So in that space, as Susan said, you're playing basketball, there's not restrictions imposed to say you can't play basketball, you can break distancing, you don't have to wear a mask, etc. But when you're looking at all those interactions and spaces around the sporting activity, so change rooms, entering the recreation facility, we're still going to have pieces around distancing and masking. So if you're doing the activity, no restrictions. If you're, in some of those other side spaces, that would be when we're asking you to follow restrictions. And I'll say there's a strong alignment in that with our fitness centers as well. So, when you're doing the fitness activity, we're saying you do not have to wear a mask, but when you are moving through a center, when you're going to the change room, et cetera, we will ask you to be masked.
So just a follow-up on this one might be, what about coaches, officials, trainers? Is there going to be any requirements for them to mask or distance in activity?
Yes, in stage 2, there will be masking indoors for trainers and coaches, and that if the trainer or coach has to step in or and participate for part of an activity, like a swimming coach has to get in the water, demo something, obviously then masks can come off for those types of things. Outdoor masking for coaches won't be mandatory, but indoor masking for coaches will be, and physical distancing. The way I look at it is like where you can, you absolutely should. So where you can mask and where you can distance, you absolutely should. Like while COVID numbers are decreasing, hospitalizations are going down, we're totally trending in the right direction right now. I still think we need this frame of mind of where you can, you should.
Okay, thanks. So stage 2 still, sports still, with no restrictions. What about league play? What about tournament play? Like, is it all on? Is it, we had the cohorts before. What does that all look like?
So yeah, so right now it's enabling. It's definitely enabling those kinds of like leaves and even tournaments. It was explicitly prohibited in the orders before that you couldn't have tournaments and competitions, league play, that kind of thing. So that those kinds of things are back on. I will say that there is we will have this group of children age 0 to 11 with no protections. So there is lots of discussion around here to try to figure out exactly what sort of parameters we put around that group, just to protect them and protect like the broader population. So I know everybody's anxious to see those, and we will definitely, as Damien said before, we're definitely working behind the scenes on those and trying to get something out to the stakeholders as soon as possible.
Yeah, and if I could just follow up on that, Steve, I know we've heard a lot, especially from individuals in this sector, that, is there public health advice, recommendations for working with those groups? And so definitely been heard. And as Susan said, working to get out some recommendations in those spaces. And that, if I'm looking at and just reflecting on some of the interactions that we've had with stakeholders in this space in the last week, I'm hearing a lot from people who are saying, if we're looking at stage 2 as kind of a legal framework, and we're looking at stage 3 is where, restrictions are not going to be imposed, what does my tiered plan look like to try to ramp up and really, support stakeholders and their confidence in participating in these sports. And when I hear that, I think my feedback to those individuals is that sounds like a great plan. Taking what's there as the framework and developing your own policy plan, et cetera, makes a lot of sense. As I'm sure we're all going to be experiencing this transition together. And I look at a question like, is it really no restrictions? Is a bit indicative of, where we've been for the last number of months and where we're going, and some of the hesitancy that, does tie into those conversations.
So can I assume, again, a little bit of a follow-up on the under 12s, and can I assume that these added protections that you talked about would probably be outside of the field of play again, so that people are planning like league play for kids right now, that would on field at least look similar to what they're used to doing in terms of their sport?
Yeah, so soccer will look like soccer for the little guys. Yeah, so it's not that. I think we're more deciding about group size and what would be an appropriate group size. And again, looking at it from really a lens of enabling, not from restricting, but just enabling. And as Damien said, like just putting some parameters to keep those kids safe. And we are hearing quite a bit of feedback of the concern for that group. Like quite a few stakeholders are actually concerned, as everyone knows, and Damien has mentioned on the call, that 12 plus has had the opportunity, and now they've had had like at least a few weeks to have the opportunity to at least seek out one dose of vaccine for themselves and their families and their adolescents 12 plus. But that group from 0 to 11 still isn't eligible for vaccines. So they're essentially a vulnerable group, vulnerable to COVID, to actually getting COVID and potentially spreading COVID.
Okay, perfect. Thank you. A couple more before we get to the lists, and I see it's populating well. I think we've already answered some of those, hopefully through this. But another one that I've been at a couple tables with that's come up would be fire codes in larger facilities at that third capacity. Is there going to be any sort of guidance or specifications, because large facilities have huge fire codes? I even learned that fitness amenities or fitness centers don't even have a fire code kind of restriction in some places. So, or what it should be. So what does fire code in a large facility look like? I'm assuming you don't want them to take, if they have 1,000 person capacity, to move them all into the arena for an event or something like that. So do you know what fire codes in facilities will kind of look like?
I wasn't sure if you want to tackle this one, Susan, or not. So, I mean, in terms of that, what we're talking about realistically would be in the settings. So, I mean, there is a fire code associated with a number of recreation centers, and you're right. We're not asking people to take the maximum amount of people and put them all into one space. And when we're in indoor environments and we're not participating in, let's say, a sport, we really should be maintaining distancing and masking. But if you're looking at the individual settings within recreation centers, many do have fire codes specific for arenas, like ice houses and things of that nature. And we'd ask that you would follow that fire code in maintaining the 1/3. Just knowing that sector, I don't anticipate that to really disrupt a number of the sporting operations. And I know in some of the common spaces as well, provided, we're really focused more on the maintaining the distancing and the masking. We should be able to maintain kind of the 1/3 fire code in those spaces, and people can travel to and from where they need to in those larger rec centers. But look at the setting, and if there's a fire code attached to it, use that as your barometer. So the example, yeah, the arena, the field house, the gymnasium, so on and so forth.
Okay. I know with some community league centers, drop-in activities is popular. So like drop-in youth basketball, as an example, is that going to be treated any differently than a sport activity? And this kind of links to another question: is like, what should facilities programs still be doing in terms of contact tracing and registration and knowing who's in their activities and stuff like that?
So I'll start with the drop-in piece, and maybe I'll turn it over to Susan for the contact tracing piece. So the sporting activity itself, we wouldn't have restrictions imposed upon it. Of course, what we would ask is that as someone's entering into that community facility, they are respecting masking and distancing. Same thing if they're entering a change room, so on and so forth. But when they get on the court, whether it's to shoot a basket or what have you, that would be a permitted activity without restriction. Fortunately, in a number of these spaces, there's some fairly strong contact tracing pieces inherently built in, which I think is also fairly enabling in this space. But I'll let Susan talk more about that side of things.
Yeah, thanks, Damien. So we have had this conversation here. So, and from what I know about rec centers, there is either people are scanning in or people are paying so that they have a record of them being there. So for the time being, contact tracing will continue, and the contact tracers at AHS will attempt to find and communicate with all the people who would have been identified as a close contact of someone who was involved in a sport, and whether that be a drop-in or like a registered program, or a team that's like a fixed team that's always the same, 12 kids all the time. So contact tracing will continue, and there will be requests to have that information. I think we're just basically moving less from like that you must, is that more that you should be doing this rather than must, as we move through stage 2 to stage 3 when it comes to contact tracing.
And I saw it's on second on here, kind of links to that. What about daily health screenings as participants arrive?
You know what, I think, and this is, a message I think that for all like sports organizers, I think that type of daily health screening is something we should do, for long term. And I realize right now it's quite regimented. It's answering these exact questions. So I think when, as time goes on, we can be less regimented about exactly answering and checkboxing but I think what we really need to do, if there's one thing we've learned from COVID, is like we can protect each other by doing those things. Like one of the big public health recommendations that will stick long term is stay home if you're sick. So those kind of screenings, that I think we've probably all gotten. I know I've gotten into very good practice with my kids, like being like, do you feel good? When I see them sneeze, I'm like, did you just sneeze? Like we're making sure that we're checking on if you are feeling well, and should you be going to that activity, because you don't want to spread whatever you have. So I think that one in practice would be a great one to keep in practice. If I was a sports association building my plan, that sort of piece of it would be part of it. The other things that I think that we should be all looking forward is like what have we learned from COVID that's going to help us through? So things like cleaning and disinfecting equipment, staying home when you're sick, distancing when you can. All these kinds of things will carry us through in continued, hopefully, success to as we get like through summer into fall.
Perfect, thank you. All right, Damien, it's either you or Susan, but I know last time, and I'm just going off my questions here now. So the first one's pools, aquatics related, and you at the last time I talked, you didn't have some of those answers, but what does the aquatic environment look like, including hot tubs, steam rooms, other amenities outside of like lap swim or public swims?
It's the race and mute button for Susan and myself. So I mean, in the aquatic environments, we'd be treating that the same as the rec center in terms of the 1/3 capacity. I know we've had questions that have come in pertaining to lane swimming and to families and things of that nature. I mean, if I'm looking at it from a sport perspective, and you have your swim club and things of that nature, as we've said in an activity, you would not be bound by restrictions. If I'm looking at it from a social interaction point of view, and it's a family who wants to come and enjoy the pool, we'd ask that family to stick together and maintain distancing from other families. But in terms of the usage of the pools in stage 2, I should be careful of this, maintaining that 1/3 capacity. Of course, right now with stage 1, we also have outdoor pools, which I know are operating with up to 10 people distance. Anything you want to add to that, Susan?
No, I think that just about covers it. It's like it's the capacity and the distancing. So again, if you're in there to the pool to play water polo, then you're not distancing, that's understood. But if you're in there, like Damien said, as a family swim, and you're swimming as a family and you're distance, there's no like social gathering. So you wouldn't have a birthday party at a pool as an indoor social gathering, that type of thing. I think I just see a question unrelated to pools pop up about this difference between indoor and outdoor pools, and just the right now, though the indoor pools aren't open, but come stage 2 they will be open.
And I just saw the question pop up pertaining to masking. And did you see that one, Susan?
No, I didn't, sorry.
Okay, it's just masking in pools.
Masking in pools. So like when you're in the water, there's no masking. What
Okay,
about
right.
Like change room to the pool?
Yes, so and those would be understood that it's not going to be perfect, but yeah, so the masking order will apply in those indoor spaces. So you should like change, put your mask on, walk up to the pool, take your mask off, swim, put your mask back on, like towel off, put your mask back on, and head to the change room. And, you know, obviously the mask can come off when you're in the shower and those types of things, like just being really realistic about those pieces. But anytime you're in like the shared common areas, you should have a mask on, not while swimming.
So there won't be any specific guidance, like I'm thinking hot tubs and steam rooms, areas where you're sitting, and it's hard to distance. I mean, there won't be, it doesn't sound like you guys are going to have any specific guidance or restrictions around those types of spaces, but like distancing would still be
Exactly.
maintained.
Yeah, exactly. So if you're doing like your capacity of your entire pool is 100, but if you have a small hot tub, you can only like realistically fit 3 people in a hot tub, keeping the 2 meters distance. So there should be in step or stage 2 those kind of parameters put on those smaller spaces where it's definitely harder to keep distance.
You know, Damien had to clarify there once, so I think most of my questions are going to be stage 2 related, if I don't say that in advance of the question, because stage 3 I'm taking I'm assuming there's still going to be some guidance in terms of masking and distancing and protocols like that, but that it's a bit more open. But so if that's not clear, I think that's most of this is stage 2 related.
Yeah, no, for sure. And thanks for that, Steve. Just a quick comment on that one. I mean, I think in stage 2, where with the public health restrictions, again, it's that legal framework. So if you're looking at your steam room, how many people can you realistically have in that space with distancing measures for indoor activity? But as you move from stage 2 into stage 3, obviously public health restrictions are being lifted as part of stage 3. That's again really around the legality and the legal framework for operation. But when we're moving into that space, you know, it's really good to think about these public health restrictions as recommendations, best practices in many cases. So if I go back to the general guidance, you know, when you're indoors, making sure that you're masking, you're maintaining distancing, you have good sanitization practices. These are all going to be, you know, recommendations and best practices as we move forward. Because stage 3 doesn't mean COVID's gone. It does mean we have a high level of community protection, so we can go back to a lot of our normal activities. But of course, we would recommend doing so as safely as possible.
Next one up here, I know many people are eagerly anticipating this stuff, but and the guidance on summer day camps or day camps, do you know when those might be available? And I've heard that there is going to be specific guidance with day camps.
There is going to be specific guidance on day camps, and it is like in the works, and it's just working its way through the approval process. So like as Damien said earlier, we hope to have those just as soon as possible, because we understand that that the stakeholders need this guidance in order to plan. So it's coming.
Yeah, and I did reach out to our incident commander before the session began to see if we're able to send that out here today. Doesn't look like today, but we are trying to get it out here as quickly as possible, and really with the deadline of this week to get it to our day camp and overnight camp stakeholders.
That'd be great. I know lots of decisions having to be made on whether to run programs or not based on those. So just put that word in. Spectators in indoor sports. So I'm assuming it's tied to the capacity fire code stuff again. Masking and distancing. Any other suggestions on spectators?
The biggest thing I would say to look at in terms of spectators, well, I guess there's 3 key criteria there. When you're indoors, you're looking at fire code capacity. When you're outdoors, there's often not fire code capacity, so you want to look at seating capacity. And if you're outdoors and you don't have seating capacity, then really looking at that limit of 150 people for an outdoor public gathering would be the kind of that trifecta that I'd be looking for when interpreting the stage 2 guidelines.
Okay. Next one's pretty specific, although spray parks just opened up in the city of Edmonton here. So do either of you know of any sort of best practices or guidance? I doubt there'd be guidance, but best practice in terms of disinfecting spray park equipment. I don't, probably putting you guys on the spot. I don't know if you have anything there. But
You know what, there's the environmental health, that's not my area of specialty for sure. My colleagues in environmental health, they know all about the spray park disinfecting. So we could connect, I don't know if someone could jot down who that question is, and we can connect those people with like Deb Mooney and other people through at the Ministry of Health who deal specifically with this, but I don't have an answer off the top of my head, but I know who does.
It's Suzanne Merrill's, but I'm assuming this might be a popular one. Like everybody rents spray parks, so it might be something like if you can just connect back with me, we can send something out if there's
For sure.
some common stuff.
And we can loop this one also in through our municipality work. And so for people who receive the municipal Q&A weekly, we can try to get the question popped in there as well.
Perfect. Thanks. Next one up. Will there be any restrictions on the capacity of group sizes on an ice surface? And will there be any requirements to keep adult and youth in separate groups or zones on the playing surface?
So there's no distinction in stage 2 between adult and youth. I know we had like a distinction before where we enabled youth sports but not adult sports. So any of those 18, 19-year-olds that were maybe participating couldn't participate, but the way the orders are written, but that's not how stage 2 is. So there can be like a mixing of adults and children on or youth, I should say, under like on the same surface and that sort of thing. And can you remind me what the first question was, Steve?
Just the capacity on an ice surface.
Okay.
Like, is that just going to be the fire code or the capacity?
Yeah. Fire code capacity for that type of thing. Again, I think it's where you distance, you should. Obviously in a hockey game, you're not going to be distanced from each other, but distancing where possible. So I think of like a public skate that I was at once where it was so many people you could barely skate. Even if that was within the fire code, that would be not the intention of what we're trying to do here in stage 2. But I think ultimately we need to go back to like the fire code, and if it's not a game, or if it's not like we talked about, like something where you actually need no restrictions to do that activity, then we're back to distancing. And a reasonable number so that there is distance between families and those types of like families and people who came together kind of deal.
All right, thank you. Next up, masking requirements for personal training sessions and indoor group fitness classes. So I know that this time you don't have any differentiation between low and high intensity, but while they're doing the activity, no mask. While they're not doing the activity, mask.
Yeah, so if you're in a fitness class, 3 meters spaced, no mask, that your trainer should wear a mask while there, but the participant, it is not required while they're exercising.
Unless you're like a spin or trainer where you're actually on the bike too, I would assume.
Yeah, I mean, if you are actively participating, then you do not need to wear a mask again, but the 3 meter spacing is important there. But if you are a trainer who's for the lack of better words, running an exercise class and not participating, then you would be expected to wear a mask.
Thanks. 20 minutes left here, so we're going through pretty good here, so we'll keep on going. Swim instructors. So can swim instructors be back in the water teaching lessons to their participants, doing hands-on instruction and physical manipulation where needed? Is the physical distancing restriction lifted so parents and guardians can participate in the water during the lessons?
So in terms of the parents guardians piece, that one's easy. That's a yes. That was actually you were able to do that before with the parents and guardians. It was just with the maximum of 10 people as the capacity restriction. But your parents, and really think about a lot of those younger populations, the toddler swims and things of that nature, that can continue. Susan, I saw you took your mute off as well.
Yeah, no, you answered. Good, nothing to add.
Okay, this one's kind of a look into the future, so I don't know if you can answer it, but I do know that a lot of groups are looking to bring in tournaments and events and stuff like that, because it's needed for the organizations, it's needed for economic development and tourism and stuff like that. But they're just kind of projecting out and knowing when they'll have a confidence level that they can put a bidding event in for provincials or nationals or something like that.
I mean, if we're looking at timelines, stage 3, I know the earliest date that was projected was the 28th of June. Of course, it could go into July. It all depends on obviously the vaccination rates. But as you're looking into the summer, you know, there's a very high level of confidence and probability that will be in that stage 3 territory tied to vaccination rates. The piece I would also mention as part of that, there would be no provincial travel restrictions that are enforced by the province. Now, if people are crossing borders, that's federal jurisdiction. But you know, in the last couple of months, we have had some travel restrictions between communities and things of that nature and recommendations. So those would not be in place. Obviously, we wouldn't have the stage 2 restrictions in place as part of stage 3, but there's definitely some great ideas there to maintain in terms of distancing, in terms of change room use, in terms of sanitization that you might want to build into those plans, and really, you know, make sure that we're protecting people. But as we're moving into the summer months, in particular July and August, we do expect to be into stage 3. That would be no public health restrictions. From a legal point of view, we'd have some recommendations, but that would be where I'm looking at in terms of time frames. The piece I guess I should add to that would just be around second shots. So the announcement was made earlier this week around the second shot plan. We do have people who have received the shot vaccination in March who are now eligible to get their second dose currently. If you received it in April, you will eligibility starts on June 14th. If you received it in May, eligibility starts on June 28th. And what I think part of the piece that's getting not getting as much attention based on the fact that the plan is tied to first doses is a significant increase in second dose protection that we do expect to grow here in June and really continue to grow into early July. So as we move our way through June, it's not out of the realm of possibility that we'll have 30% of the population or higher with the second. As we move into the middle of July, it's not out of the realm of possibility to have 50%. Of course, we're strongly encouraging all Albertans to follow up on that. We're also all of the groups that we work with to help share information as it pertains to the vaccination program. We do have plain language FAQ online. We do also have a support document now for employers if you're interested in learning more about the immunization program or the vaccines themselves, or want to share with coworkers and other stakeholders in your areas.
Well, oh, sorry, go ahead, Susan.
Can I just add to what Damien says? So, and just more of my, more just to add to what he said really is that I think I saw a question in some of the questions that were sent in pre-session about like what can we do to make sure that we don't have to go back a step, because I think that's what everybody is worried about. And I think if I have to answer that question in like is get immunized, that's what we can do to make sure that we don't go back a step, is get immunized. Like yes, there are variables that can affect that, and there's variance and there's this and that, but I think that is if I had to pass the message, a single thing that we do to make us go forward and not backward is to get immunized. I think that like the sports and rec stakeholders are in a position of being leaders in their community, and that all of us need to take this on as to supporting and promoting immunization for those that are eligible. I saw another question pop up in the chat box. Now I can't find it now, but it was about, well, how do we protect the 0 to 11s? And that's exactly how we protect the 0 to 11s as well. When we protect, the bulk of the population, we see less disease transmitting. You see less disease transmitting in the younger kids. They've seen it in other parts of the world that are ahead of us in immunization. When they've immunized the older kids and the adults, they see way less cases in the littles. So I think that is like the single biggest thing that we can all do is to get immunized and promote immunization, COVID vaccine at every chance we get.
Yeah, thanks. I saw that. I know the answer to this from your perspectives anyways, but it was in the pre-questions. I see it down the list here a little ways too, is around the ability for organizations to ask or programs to ask about vaccination prior to registration. And I've sat in on a couple legal webinars on this, so I know it's a gray area, so I'm assuming it's going to be a gray answer, but so any kind of guidance on that? I know the answer right now is probably it's a tough space, but
yeah, I think each organization, I think that's on my answer too. And Damien, feel free to jump in. Is that like every organization should be consulting with their legal with a legal advisor to get an answer on this. So, you know, short of having that, what we do have is like, you know, the leadership of all the people on this call who want the best for all the people involved in the sports, rec, and physical activity sector.
Yeah, and the only other thing I would add to that is what has been said publicly previously by Premier and other ministers, that they're not going to legally mandate that Albertans need to be vaccinated. So that would be part of that conversation. I think on the other side of things, as opposed to the musts that we're hearing those questions around, also starting to hear some of the stuff around, you know, some of the creative ideas around encouragement and things of that nature. So I know a number of groups are exploring, are there different perks, or there are different ideas and different offerings that they can put out there, working with their staff, stakeholders, etc., around vaccination. Certainly, if that's a conversation you're looking to explore, we would love the opportunity to chat further and hear from you in terms of some of your ideas.
Okay, perfect. Another specific one, in the old guidance, there was in aquatics, there was the need to have a COVID monitor on deck. Any words on that requirement?
I think it's less about having, and I don't remember the exact wording of how it was, but having a COVID monitor, but there would be needing someone to make sure that the capacity limits were adhered to. So I think there would be that type of monitoring. And obviously, if people are allowed to be, you know, like the water polo example, in each other's space, that wouldn't need the monitoring that it did before, when we wanted everyone to be training, everybody to be distanced. So I think it's probably an operational question more than it is like a government restriction that we put on facilities. Damien, do you agree, or do you have anything to add to that?
No, I agree. I haven't heard anything pertaining to a COVID monitor specifically. And you know, I think based on this particular piece, and when we're really looking at stage 2 to stage 3, it's more of a policy and operational conversation, and probably one that I'm assuming many people on this call are trying to think through in terms of what do their steps look like, regardless of kind of the provincial policy and order. So if that's something you're looking to do, then there's nothing that we would do to stop you, certainly, but it's not a specific requirement in this or as we enter stage 2.
Perfect. So the indoor we've dealt with in terms of capacity loads and stuff like that. Is there any sort of guidance for outdoor? Like I'm thinking if you were, you know, baseball, like a baseball game, but with, you know, thousands of spectators, like is there any sort of stage 2 limits on large outdoor gatherings? I guess it was 150, was it?
Yeah, so I mean, there's a couple sensitivities here, and just try to walk through them. If you have you know, a fixed seating capacity, so as you brought up a baseball diamond, if it has bleachers, it would be 1/3 of the bleacher capacity, seating capacity. If you're looking at an area and perhaps it's more of a public gathering, you'd be looking at, so there's not fixed seating capacity, but we're gathered at a park for a singular event, then we'd be looking at a max capacity of 150 people. If we're looking at, and I know a lot of soccer clubs do this, you know, running multiple soccer games on a larger field, that would be permitted. We just need to maintain distancing between the parties.
And then kind of moving into stage 3 here a little bit, but do you guys know if distancing and masking is going to be a part of stage 3 still? I'm thinking more in indoor spaces, indoor facilities as an example.
The intent is to lift indoor masking and distancing as public health restrictions, and again, legalities. However, we'll make recommendations around, you know, continue to wear a mask when you're indoors, especially if you can't distance, and things of that nature. So that'll really be the shift, going from law to recommendation and best practice when we're looking at those things. And I just saw the piece that popped up around, can you be more clear about the 2 meters or 3 meters distancing indoors? You know, if you are participating, or sorry, if you're indoors and you're masked and you're, you know, just generally moving through space, the recommendation is 2 meters. If you are indoors and you are participating in a fitness activity per se, so a fitness class, then it would be 3 meters. When you're outdoors, masks are not required, but 2 meters distancing is what is asked of people. So those would be the 3 bullet points to take away on the distancing pieces.
Perfect, thanks. I know we dealt with this at another meeting. I don't think we got a final answer, but on the lane swimming, because I didn't know this, but I mean, I figured it, but lane swimming, lanes aren't 3 meters apart usually. So is there any help on guidance in terms of lane swimming, rather than, because I think people are worried you make those lanes 3 meters, then you run out of a lot of usable space pretty quickly, but.
You know, I think that would be, let us take that one away, because I'm not sure that we've considered that exact scenario. So I think it comes back to like where you can, you should. There's obviously less chance if it's just like transiently passing, like, right, if you're just like passing each other in lanes. So let us take that back one. Dean's on the call here with us, and we're trying to basically gather any of these kind of outstanding questions that seem to be, you know, that we here at Alberta Health don't necessarily know is happening, but it's probably this one would apply to rec centers across. So if we know that these kinds of things are like, you know, the burning issues, then we will put a bullet point in the guidance that speaks exactly to this. So Dean can track this one as an issue that I don't have an answer like right in this moment for.
Yeah.
And then we can put something like try to be clear on it in the guidance.
And just to jump in there, Susan, it did come up on a previous call earlier this week. It just hasn't landed yet. So it has been shared in with the rest of your team, and I just don't know where that one's particularly landed. We got some language pieces too that have been recommended, and if you have additional language pieces, feel free to put them in the chat and we can take them away.
Thanks. Just looking down the list here. So just to clarify this one so that there's no confusion, BizConnect told us today that for stage 2 indoor youth sports, participants will still need to be maintained distancing at all times. So how is gameplay possible? So just to reiterate what we said, so gameplay, if it's a sport that requires, you know, close contact, that's okay in stage 2, but as when they're away from the activity, that's when the distancing should be maintained with masking.
Yep, and that's a good flag, and we can work with BizConnect to correct.
Okay. The swimming lessons piece, I noticed that. So can we run swimming lessons with no restrictions with kids in the pool? Just the instructor is still trying to distance. So I would, you know, this is kind of the gray area. It's not actually a sport, you know, like you could probably run swimming lessons with distancing, but you can't have as many participants. So, you know, is that going to be considered fall in the category of sport where they can have a lot more kids back to what they used to have in terms of their lessons?
I think this one to me follows where you can, you should distance. So obviously there's the capacity of the recs of that area of the rec center that would be important to follow, and that you know, where you can have enough, like, so if they're all like swimming laps, you're making sure that you have at least 2 meters while they're in, like doing going back and forth and doing their swim lessons, that would be ideal. But there isn't a max capacity on number of kids it could be in a swimming lesson.
Perfect. This one was an interesting one for me because I thought about it earlier today too. It's like, so you know, with day camps, they're going to have specific restrictions or guidance, but a lot of some day camps are sport-based day camps. So I'm assuming you're going to try to make sure that the guidance kind of doesn't, I guess, impact one or the other, you know, like, so you can't run a summer day camp that's sport-based with contact.
Absolutely. I think what the person might be asking for, and I think I don't see the question coming up here right now, but is that there will be alignment. So I think same set types of things that we've been talking about. So where you can distance and mask, you should, but if part of your day camp is starting to, you know, play a floor hockey game, then you can take off your mask and you're not going to maintain your distance when you're doing those kinds of activities.
Perfect. I remember we had this one before and we couldn't, we did answer it, but I don't think it was what the person was looking for. So, you know, they're running events, so it could be fundraisers or whatever. What's the kind of, in stage 2 restrictions on those? Is it the 150? Is somebody's noted in their question, or what does that look like?
So if we're running like a fun run fundraiser for,
that's what I'm thinking.
I know in St. Albert they have one for the Zebra Society, usually annually, and things of that nature. Yeah, Steve.
Yeah, that's what I'm thinking it is.
Yeah. So I did ask about this one. It would fit within the adult sport piece. What we would say though is if you're having any sort of parks, especially in stage 2, so really in this June timeframe, that you avoid kind of the large gatherings. So I know I've worked with a number of endurance sport providers here in the province, and they're coming up with plans in terms of stage starts and stops so that they never have a large number of individuals grouped up. It's really just maintaining that adults are participating in that sport in a distance fashion. And that seems to be the best way to go forward. So your risks, so to speak, are not in the activity itself, but in those post surroundings. So how do you get people registered, entered, and off, and then what happens when they finish? That would be the space where we'd be looking at making sure that we don't have groupings above that 150 level when in this stage 2 June timeframe.
Perfect. There's a few questions coming in here for.
Can I just add one thing?
Yeah.
Sorry, Steve. Just about like in some of like the runs that I've done, there would be sort of a social gathering component after, and that would still be limited to 20, right? Outdoor social gatherings. If it's like a mix and like mingle type of event, that would still be limited to 20. But if it was like more of like a, you know, an awards kind of thing where it was like sit and give out awards, that would be okay and up to 150. But if it's like an actual social gathering, then it goes down like to down to 20. I think I saw a question here about, I think it was something that I said that was confusing for someone about basketball. Did you see that one, Steve?
No,
Okay.
but I do have another, maybe before you do
Okay.
the basketball one, there was a few on here about, I think there's more clarification required around in stage 2 about hands-on swim instructors. So in the water, teaching, manipulating if needed. I think that we must not have been as clear as needed because it came up 3 times here. So.
Yeah, no, and I can see that. I think what we've addressed would be capacity limits and parents, but I don't know if we've talked specifically about the structure or the instructor, sorry. And so, I mean, forgive me if I'm wrong on this one, Susan, but I would look at that one as the same as any sort of coaching requirements.
But with the coaching requirements, you said there was distancing and masking, but in the pool. But if they're actually in the pool.
Right. So it's where you can, you should, absolutely. Where you can distance, you should distance. But if you need to go into the pool and if you need to, you know, to show something, demonstrate a skill, help a child to float, those kinds of things, that you could do it. Where the swimming one gets a little fuzzy is because in other sports, we say that if you're going to breach the 2 meters, then you need to be putting on a mask. So even in an outdoor setting, if you're going to breach and come close to correct something, the instructor should be putting on a mask. So I think that gets a little hard to do in the water, but things are opening up. And so the other thing is, I think we need to remember is most of those, so I think the vulnerability there is both probably for the child and for the teacher who may be breaching the distance. You know, in the 12 plus age group, those people would have had an opportunity to be immunized. So I think that's a good check mark in the right direction, that we're reducing risk for everyone just by having, you know, more people who are breaching the distance immunized. So I think, again, immunization, I'll never stop saying that we need to all keep doing it. But there won't be the restrictions that there were to, like, that you cannot breach the distance. I would just try to keep it as temporary as possible, breaching that distance, because knowing that anytime you get that close to a person, there is a risk.
Yeah, and so obviously that's the sensitivity around the masking, because it's difficult in swimming environments and aquatic environments. But if just, I saw the one question pop up too, like if we lift that up across sport and fitness and things of that nature, if an instructor is required for any sort of hands-on adjustments, etc., it is permitted, but that instructor should be wearing a mask.
Perfect. So we're at 4:01. Did you see the basketball? Remember the basketball?
Yeah, I think
one?
it was. I think this was confusing about the distancing, like in a public arena, and I was kind of thinking not skating lessons or that type of thing. I was more thinking public skate, and having to, if your ice capacity was, you could have, like, you know, if your fire code capacity was 1,000 and you could have a third of that, that's maybe still too many for that surface. So that's where I was saying, look at like the space that you have and make sure that you actually could keep that distance. So if it's impossible to keep distance, then it's probably something that shouldn't go ahead, is kind of where I was going to. The not that you had to keep 2 meters distance while engaging in skating and skating lessons. I was more had that public skate in mind when I answered that question of what a public skate would look like.
Yeah, really trying to differentiate, I guess, in between the sporting activity and the social activity.
Yeah.
All right. Just to be fair for everybody's schedule, you guys may have other meetings to go to and stuff like that. Thank you for the hour you've been able to give us. I think we did get through a lot of questions there. There was a couple of ones we made notes to follow up on, and I've jotted those down as well. So any parting comments?
I just want to say this is helpful for us too here, and Dean on the call as well, listening in to kind of hear the questions that are coming up, because when we can hear the questions firsthand and see some of the scenarios pop up in the questions, then it helps us to you know, make the guidance such that it's helpful for you as a sector. So I appreciate your time and appreciate the questions, and thanks to Steve and crew for organizing and doing an amazing job moderating.
Yeah, absolutely. And so, you know, thank you to everybody for the time and the questions. As Susan said, it's incredibly helpful. We know the you know, the sensitivities around timing and get moving things in this sector, and you know, with the 10th looking more every day like the realistic starting date, we want to get as much information out as possible, as we also prepare guidance and trying to get that out in advance as well. And last but not least, you know, these have been tremendous forums, 500 people often at a time, where we're able to communicate and share information and really gain a lot back. And so thank you to ARPA, and thank you to Steve for convening, and also thank you to the Ministry of Culture, Multiculturalism and Status of Women for also being a coordinator and ensuring that we're able to get this event held today. Thanks, everybody.
Yeah, thank you, everybody. Good evening.